Well, we've all heard about cone beam. We've all heard about digital dental x-rays. We've all heard about CAD/CAM. We kind of know how each one of them works individually, but what we've created here at my practice is a seamless environment where all of these technologies actually are integrated together. So there's overlap where the cone beam actually communicates with my CAD/CAM and vice versa. My CAD/CAM actually communicates with cone beam. So because of those integration levels, we have the ability to actually change the way we're performing dentistry. Take, for example, when I speak of the integration between CAD/CAM and cone beam. When a patient comes in for an implant consult, which is one of the hottest topics in my practice that doctors come to see, is we actually take an opportunity to design a tooth virtually for the patient that's ideal for the patient. We show the patient in front of them, chairside, how it's designed, what it looks like, how it would function, specific for that patient. So not just an arbitrary generic tooth, but a tooth that's perfect for that patient. And we make a virtual copy of that. Now, I show my clinicians that are in the courses how to actually take that virtual tooth and send it to the cone beam, where once the patients have had a cone beam scan, a 3D x-ray, we can now not only see the anatomy within which we can certainly plan an implant, but now we can actually see that virtual tooth that we created, specific for that patient, in that cone beam x-ray. Now when we see the tooth, we know exactly where that implant needs to go. So it answers all of those questions. The questions are, what is it going to look like? Is it in the right place? Is it going to be a challenge to restore? All of those things that run through our minds as dentists are answered in your consultation appointment. But the reality is when you show your patients that actual process, it speaks 1,000 words. We all have heard that saying, an image speaks 1,000 words. And now when we show multiple images of the virtual process of where that tooth is, how an implant should be placed to support that tooth, and reverse engineer the whole plan, we can discuss confidently and certainly explain the procedures to our patients with more clarity. But the real benefit is that now once we've planned our implant, I show my clinicians how we can actually send that data back to a CAD/CAM system and mill the surgical guides. So we're not just talking about where the implant should go and then relying on our hands to place the implant, but I can actually show clinicians how to perform guided surgery in one visit even, so that the implant ends up exactly where we've planned it. And then the CAD/CAM system picks up where we left off after the implant's already been placed, and we can restore the patient. And we teach our doctors how to restore implants in a concise fashion so that it's cost efficient but maximizes the aesthetic outcome, and have full control over that entire process from start to finish. So that's the level of integration that we're talking about, and that's just for a single tooth. You know, once our doctors have mastered single tooth dental implant dentistry, then we can then challenge them and show them the journey of how we can start to think about these larger cases, these larger reconstructive cases, such as all-on-4 and teeth in a day. And not only just show them the workflow, but then show them how to implement the business strategies, the marketing strategies, and then developing their own in-house lab so they can absolutely get full control from start to finish and reduce their costs and their lab bills by bringing that aspect of the dentistry into their offices, into their businesses, and really changing the way they think about implant dentistry.